Good morning. It is Monday, March 14th. I'm Alexis Delcid in for Jessica Lovell today. Welcome to the Morning Medical Update, and thank you for joining us now on Facebook, YouTube, and now on Twitter. Coming up on the show today, scientists have found the coronavirus in 29 kinds of animals, ranging from cats and dogs to deer. And word this morning of the first possible case of deer to human transmission. Dr. Juergen Richt from K-State Veterinary Services joins us to talk about that. And we're taking your questions on how to best protect your pets from COVID-19 and other things that could impact them this summer. And Dr. Dana Hawkinson is here taking your COVID-19 questions as well. Taking a look this morning at headlines from around the medical community. If you're planning a spring break trip that involves flying anywhere, remember your mask. The Biden administration has extended the mask mandate for another 30 days. It had been set to expire this week. The TSA implemented its mask mandate with an expiration date of May 2021, but that's now extended through next month, April 18th. A new study has found that people who eat less meat have a lower risk of getting all types of cancer. Researchers from the University of Oxford say the reason is still unknown exactly, but they do know this: most people who don't eat meat are younger and less likely to drink alcohol or smoke. And apparently there's a link between looking sexy and living longer. Researchers at Texas Christian University say men who were considered sexy had more natural killer cells. Those are the cells that fight infections and cancer. When it comes to women, though, it's a little bit different. Women with fewer natural amounts of killer cells have more estrogen, which tends to make them appear sexier. Now to the show. That's quite a study. I wonder how they quantify that. Dr. Hawkinson, be sure to send us your questions. Get them into us on YouTube, Facebook, the Medical News Network, and now Twitter. We have links to those right there on your screen. But first, let's get to Dr. Dana Hawkinson, Medical Director of Infection and Prevention and Control, joining us with our COVID numbers. I trust your stuff more than the sexy study.
That's right. Yeah, I don't know if that was done on an app or what, but
right.
Be interesting to read.
Point.
We'll see.
Right.
We'll see how that goes.
So how are the numbers looking
numbers today? Still lower than they have been. We have been seeing decreasing cases, which is good. So right now we have 18 active infections in the hospital with 0 in the ICU, 0 on the ventilator, still 59 in that recovery period. But overall, again, the active infections are tending to be on that lower side, and so that's good. Hopefully they continue to decrease.
All right, Dr. Hawkinson, thank you.
Thanks.
We'll get back to our COVID discussion in just a few minutes. But first this morning, we have another big development. This weekend, researchers at K-State discovered the bird flu in someone's urban chickens in Franklin County. Last week, a case was discovered in central Kansas, and that's on top of cases already discovered in Missouri. So what concern is there that the bird flu virus is now in the metro or could spread easily here? Joining us this morning is Dr. Juergen Richt from K-State Veterinary Services. Dr. Richt, this marks the first time in 7 years that we've seen a resurgence of the bird flu. So why is this reappearing now? Dr. Richt, looks like your mic's on mute.
That's correct, what you said. We had a big outbreak in 2014, 2015 in the Midwest with bird flu, and we had to cull or sacrifice about 49 million animals, 42 million chickens and 7 million turkeys, and this cost the economy about $3 billion. And we had some minor outbreaks or introduction of bird flu in the between 2014, 15 and now, but now we had several outbreaks in the past several months. And this is a virus, this time coming from the east. Before it came, the bird flu usually comes in with wild birds. And we had introductions coming from the Bering Strait down to the west coast and then into the Midwest. And this time it comes from the east. It came into Newfoundland and Labrador and down the east coast and now hit the Midwest. So it's a different epidemiological scenario than we had 2014, 15.
Is it cyclical? Could we just expect this to start happening every 5-7 years?
So the issue with H5 and H7 subtypes influenza viruses, these are the highly pathogenic avian influenza viruses for birds, is they associate with wild birds. And so they come in with flyways. And as I said in the beginning, we had introductions 7-8 years ago from the West, where it came via the Bering Strait, most likely from Korea. And now we have an introduction of a virus from the East via Labrador, Newfoundland, and most likely it came from Europe. And so these wild birds travel a lot, as you know. They have summer, winter areas where they accumulate. And so they bring this virus with them. And if we don't follow high biosecurity measurements and have contact, our domestic animals, backyard chickens have contact with wild birds, it gets transmitted, and these animals get sick and many of them die.
We do know that some protections are being taken, like at the Kansas City Zoo, they've removed certain birds from the outdoor habitat to protect them against the bird flu. Those birds are being kept behind the scenes, and crews are wearing PPE to try to reduce the risk of spreading the virus to the birds. How effective then is this, in your opinion, in stopping the spread?
So biosecurity is number one. I mentioned that before. If you limit contact with your domestic or your animals which are in a zoo, if you put them inside and they are not outside, that you limit the contact with wild birds, that's the best way to protect them. Right now, vaccines are not used. There are vaccines against avian flu, but they are not used in the United States. So the only way to help and protect our animals is with biosecurity. And the other thing is, one thing I want to add, H5 and H7 avian influenza viruses are zoonotic viruses. That means they can also be transmitted to humans. And we know that especially H5N1 influenza viruses have a very high case fatality rate in humans.
So in Iowa, the governor had declared a disaster declaration last Friday because there was this huge outbreak at 3 farms. A farm of nearly 900,000 hens was also affected. We're being told all those hens have to be destroyed. At least a dozen states, including Missouri and Kansas, are being affected. How concerning is this for us here with the food that we eat and our safety? You know, someone sitting at home who's watching this right now.
So as you remember, maybe in 2014, when this virus 2015 hit the Midwest, and as I said before, we had to cull and destroy 50 million birds. The prices for eggs, we have a lot of layer hens in the Midwest, and for chicken went up significantly. And right now, I think we have only destroyed about 3 million birds in the United States. But if this continues, we might have a similar situation as 7-8 years ago when prices for eggs and chicken meat went up significantly.
Let's just say someone eats a bird that was infected with bird flu before it's destroyed. What happens to that person?
So usually when we eat chicken meat or eggs, we cook it, so the virus is destroyed. The problem is, especially in various countries in the world where people buy live animals, and slaughter these animals by themselves and prepare the meat or the chicken fresh, that's when you get in trouble. Or if this animal is infected, you can infect yourself. So in our situation where we buy the birds already slaughtered and we prepare them and cook them, there should be not a big risk. The risk is if we destroy or work as workers, poultry workers, or if we go into these farms and have to cull and destroy these animals, we have to wear PPE, personal protective equipment, to protect us against bird flu.
And that's quite a few people, a lot of people in the Midwest are working around birds or slaughtering them or preparing them or living on farms. So those people are at risk for potentially getting sick. So someone on a farm or someone working in one of these factories.
So only if there is an outbreak of bird flu, there is a risk. That's number one. And that's why these people who own these farms or work on the farms, they're educated to understand what kind of symptoms, clinical symptoms are associated with these virus. And it's it's a very it's a highly lethal disease. So if they see a lot of death, they know it's most likely bird flu, and then they will obviously inform the regulatory agency and hopefully wear the respective PPE which is necessary to protect them.
I want to ask you another question about egg and chicken prices. As we see this moving into the future, do we see this affecting people? Are already paying a lot more at the grocery store for other reasons right now. Do you anticipate this affecting the prices of poultry and eggs in Missouri and Kansas? And if so, how long could that affect us here?
As I said, in 2014-15, when we had the last big incursion of avian flu, we had significant increases in poultry and egg prices. And if this continues like we see it right now, we could have a similar scenario later this spring and in summer, especially since a lot of migrating birds are coming back. And we have the Mississippi flyway here, they're coming back from the south. And so there will be more birds around and the spread will be more efficient. And so if this continues, we might have a similar scenario as we had 7-8 years ago, but I don't have a crystal ball.
Right. We wish we had a crystal ball because that would make things a lot easier for all of us. I want to switch gears but stay on the topic of animals and the safety of us, of humans. We've all heard of how the Omicron virus is hitting the white-tailed deer population hard. Now we're hearing word of the first possible case of a deer-to-human transmission of COVID. Researchers in Canada say it happened after the person had close contact with an infected deer. What we do know, though, is experts say that this is preliminary research which has not yet been peer-reviewed. But what does that mean to the person sitting at home watching this, or someone who's a hunter, or someone who eats venison?
So I think that doesn't mean much to the normal person. It only means that if you have close contact with deer, if you are a hunter or a wildlife biologist or etc., and you work with deer, you should be careful because deer could carry SARS-CoV-2, and this SARS-CoV-2 could have a different genetic composition than the human SARS-CoV-2, and it can infect you if you have a close contact or if you hunt an animal and gut the animal, that you could get exposed to SARS-CoV-2 coming from that deer.
I want to bring Dr. Hawkinson back into our conversation. As you hear this, with your huge knowledge base, what are your thoughts on deer infecting human and the safety here?
Yeah, no, we've known since early on in the pandemic, that humans can certainly transfer the virus to animals. We saw that in the zoos. We've seen that in research articles looking at household transmission. Really hasn't been documented is the transmission back from those animals to humans. We certainly know it's possible. If it went one way, it can certainly go the other way, just as Dr. Richt has talked about as well. We know that there can then undergo further mutations or recombinations within those animals as well. Again, I don't think it's surprising. We know that influenza viruses obviously can go from one species to another. So again, it's not surprising, and we've known early on that SARS-CoV-2 can infect other animals as well.
We know that the Omicron virus was found in a deer in New York City, and then there was another case of an animal other than a deer. A hamster was thought or determined to have caught COVID and transferred the COVID to a human in Hong Kong. Now, hamster is where I feel like it gets like, okay, that's a pet. I don't know if every part of the world keeps hamsters as pets like we do here in the United States, but that's where it starts to get raise some alarm bells. What are your thoughts on that?
And again, we know that dogs can get it, cats can get it. So again, this is nothing surprising. I think what we do have to understand is some of this preliminary research looking at transmission from those animals back to humans, just as Dr. Richt said, is early, still needs to be investigated. But again, we have models for this with other viral infections as well. So it isn't surprising that this would happen.
Dr. Richt, at the beginning of the pandemic, and I remember Dr. Hawkinson saying this as well, correct me if I'm wrong, but we were being told that we were protecting our animals from catching it from us, but it was very rare that they could give it to us.
Yeah, and that's
That's
still
still
fairly
what
true
we
that
know
we
and
know. Yeah,
believe.
and understand.
So would this just be, are we going to start hearing now rare anecdotal cases in pretty much every part of the world where people are saying, I heard a hamster gave it to a human, or you could get it from a deer? Or do you feel like this is something that's going to become a trend?
Yeah, I'd like to hear Dr. Richt's answer, but certainly I wouldn't be surprised. But again, I think these will be rare, and especially as Dr. Richt mentioned, in other parts of the world there are those live animal markets where people have more contact with live animals as far as food goes. But we know that a lot of people do have pets in their homes, cats, dogs, other pets. So again, I think overall these events are going to be rare, but we shouldn't be surprised when we hear this.
Dr. Richt, do you feel the same, or do you have any other views to add on to that?
So when we think about that, we have, I believe, 450 million confirmed cases of COVID-19 worldwide. And then we look at the number of confirmed animal cases, reverse zoonosis, where the virus goes from humans to animals, it's rather small. The only concern I have in this situation, in this scenario, is that the virus established itself in an animal reservoir. And that's what happened in Ontario. The virus apparently in Canada established itself in the white-tailed deer, and it continued to spread within white-tailed deer and became genetically different from the virus which circulates in the human population in Ontario. At the same time, they sampled these deer. Then it could be a problem that you have a secondary reservoir, and if there is a bad scenario that the virus jumps back in humans and humans are not protected with the present vaccines we are using against COVID-19. And that's the issue I see. The same with hamsters in Hong Kong and everywhere. Hamsters are highly susceptible, and they had a zoonotic event in pet shops, in 2 pet shops in Hong Kong, and Hong Kong had a zero COVID policy, and suddenly they had outbreaks. And so these are the scenarios where we have to go in and understand these relationships in more detail.
We are getting so many questions from our viewers about COVID, about animals transmitting COVID, about new variants. So I'm just going to dive right into these viewer questions. Pamela Lowe has a question, one of our Facebook viewers. She writes, glad the numbers are going down, but my aunt is in a nursing home for therapy from a fall. They have a COVID outbreak. She is tested positive. The nursing home is still allowing visitors as long as they have a good mask and no fever. Have things changed so much that this is being allowed everywhere? And can we expect the rates to go back up due to this? There are no signs posted stating the COVID outbreak at the nursing home. Dr. Hawkinson, what do you think about that?
Yeah, again, a lot of questions in there. I think that, yes, we are at a lot of health care centers seeing lessened restrictions for visitors, which is good because we know when you are in the hospital, having those friends or family there is vitally important for a number of reasons. But we know that those restrictions are lessening. The outbreaks in those long-term care facilities, in those nursing homes, continues to be a problem. I think it continues to be incumbent upon those individual patients to make sure that they're updated with their vaccination. It continues to be incumbent upon those facilities to really advocate and try to get those people that are not up to date or fully vaccinated to get them fully vaccinated as well. And again, it still is very important to use those PPE while you're in the healthcare facility. The workers, using those masks and trying to continue to do those things as much as possible, because we know those nursing home residents, those long-term care facilities, those patients are at most at risk. Mm-hmm. So it starts with the individual and making sure as that individual or as the facility that those patients are vaccinated, mm-hmm. and then obviously trying to get them early treatment if at all available as well.
Joellen has a question for Dr. Richt. Joellen would like to know, what if you don't eat chicken but you do eat eggs? Are you at risk from anything involving the bird flu?
It's a good one. There could be some contamination, obviously, on the surface of the eggs, and since you cook it or you the egg, so you are fine, but you should be concerned if there is a contamination, virus contamination on the surface of the egg. So be more careful, and like whenever you work with poultry or when you cook poultry or eggs, disinfect your hands.
I want to make sure that I'm understanding you correctly as well, though, Dr. Richt. From this discussion, you are saying, though, so we can put people's fear at ease, that you're more at risk if you're working in some sort of a plant or raising or slaughtering the chickens. And are you saying there's a very minimal risk for people who are just at home cooking chicken or eating chicken that they buy at the grocery store? Is that correct?
If you eat, we discussed that before. If you eat a contaminated chicken and you eat it raw, you're at risk. So if you cook it, you're not at risk. So you never know, right? There could be a chicken in an incubation period, has H5N1, and it's slaughtered and nobody knows about it and it's delivered. The same is true with eggs. It is not in the egg yolk or in the egg white. It is, if it's contaminated, it's on the surface, on the shell of the egg. And so if you handle chicken, if you handle eggs at home, if you cook it, it's always good to follow, to disinfect your hands or clean your hands, wash your hands afterwards.
Kathy wants to know.
Obviously, everyone who works in a poultry facility, poultry in a farm or slaughterhouse has to be aware of these, and the risk is much higher there.
And should be wearing PPE when they're doing that.
Should be wearing PPE, yes.
Kathy has a question about backyard chickens and what's the risk to people who raise backyard chickens. That's becoming more common.
Yes, I had a call last week by a person she has hens as pets, and she told me what she's doing to protect them, and that was perfect. She has them locked up in a chicken coop, and when she goes in there, walks to her lawn, she changes her shoes, puts in rubber boots, which are clean, and puts another layer of, a coat or whatever over herself before she deals with the chickens. And the chickens are not outside. That's number one. That's what the zoo did. And that was very smart and very sensitive in this situation, the Kansas City Zoo, to lock the animals up so they don't have contact with wild bird. And if you walk to your through your lawn to your chicken or through your yard to your chickens, you might step into bird poop. And that's not good. If you bring the wild bird poop into your chicken house, that might be not a good thing. So that's why biosecurity, changing your shoes, putting rubber boots on before you go in, and another layer of a coat before you go in is great.
Roxanne has a question for Dr. Hawkinson.
Yeah.
Roxanne says, she writes, since case numbers are so low, is it still recommended for immunocompromised to wear KN95? Or can we go back to cloth or surgical masks while indoors and in public crowded places?
Yeah, I mean, that's a good question. We do know that different masks offer different protection to the wearer, certainly with the KN or the K95, the N95 or the KN95 mask offering the best protection for inhalation of materials. That is always a consideration to do. I don't think you should, based on the case numbers, necessarily making that decision for you or helping you inform that decision about wearing a cloth mask versus surgical mask versus an N95. If you are one of those people that are at risk or higher risk for hospitalization, severe disease, i.e. if you're immune suppressed or immune compromised, I think it's probably always good to go with that higher level of protection, which would be the N95 or the KN95. So, but you're always welcome to use, those single layer surgical masks as well. Just understand your risk. And yes, we do know the cases are going down. That's great. But your individual risk will not necessarily change because the cases are going down. So it's always important to understand that.
Joe has a question for Dr. Richt about eggs. Joe writes, my mom likes her poached eggs, undercooked. Is this a problem? A lot of people like their eggs runny.
So I think it's a bigger problem with salmonella than with H5N1. So, but it's always an issue if you eat food undercooked. and for various reasons, and one is salmonella, and if you have H5N1, and there could be another issue. So it's always better to cook your food well to avoid contamination and infection with various pathogens. They could be bacterial, or they could be viral.
Ruth Ellen wants to know, and this is a good question. A lot of people like to feed the birds. It's peaceful, gives them joy. She writes, for those of us who feed wild birds, what should we watch out for?
So that's a very good one. So far, there is no reported case of a wild bird to human transmission of H5N1. There are many reported cases, obviously, of transmission of H5N1, H5N3, or N8, whatever, into poultry, turkeys, and domestic chicken. So if obviously you are not at risk if you don't touch the poop and the animals, and don't put your, and don't disinfect or wash your hands afterwards. So you are fine. The only issue is if you also have a chicken coop or you have a poultry facility, then you might be at risk that you bring in a virus, including H5, whatever, into your facilities, your animal facilities.
So maybe stop feeding wild birds for a little bit if you have a chicken coop or backyard chickens. Don't do it in your backyard.
Or follow very strict biosecurity measurements. I told you, different clothes, different shoes, and so on, and change everything before you go to your chicken coop, so you don't bring fomites on your clothes or on your shoes with you into your chicken coop.
And so I would imagine you just answered Janet Coy's question. She was asking if she should bring in her bird feeders from her yard. The same would go as far as bird feeders as well as feeding wild birds, correct?
There is no real risk to have a bird feeder, so I don't think you don't have to bring them in. The only issue is if you have a lot of bird feeders around your chicken coop, your risk for the chickens getting infected is increasing significantly.
Got it.
So you should think about these connections, how these viruses move from wild birds to domestic animals. And the human could be a very important vector. So there could be anthropogenic transmission with fomites, etc.
Dr. Hawkinson, Jill Jarvis has a question for you. She writes, I'm 72 and I'm 7 months post-booster. Can I safely fly to attend a professional conference in late April? Am I still protected 7 months post-booster?
Yeah, I mean, what we've seen with the most up-to-date data is that those people that have received that booster, that third dose, that additional dose, continue to have high protection, not necessarily against infection, but hospitalization, severe disease, and death. And so, we would say, yeah, you actually still are. Now, you still want to take some of those measurements to try and reduce your risk of getting infected, and that is, if you can, distance in some of those gathering areas. Obviously, wearing masks inside those gathering areas, that is always going to help and provide one more layer, even against infection itself. But you should be still protected against hospitalization, severe disease, and death, even 7 months after that booster.
Common question we always get after you answer the questions like Jill's are, is there going to be a fourth booster? If so, when? Because people who got their booster in August are wondering, well, geez, should I get a fourth booster shot, or when will that happen? Do you have a crystal ball? Or
no, I know over the weekend the Pfizer CEO came out and said people are probably going to have to get a yearly booster because of lack of protection. But if you read it again, it's lack of protection against infection itself. But the vaccines, if you are up to date, continue to provide great protection against hospitalization, severe disease, and death. And so that is really what we're looking for in the effects of these vaccines. And I think really the data is still being analyzed and hasn't really fully been presented on people who have gotten a third dose versus a fourth dose or a second booster. And then again, how far timeout are you from that boost as well? And so we're still looking at that and waiting for the updated recommendations. But right now, you still have much reduced risk of hospitalization and going to the ICU with your boosters, so you should feel more comfortable about that.
I have one last question from Isaac. Isaac has a question about a COVID vaccine for dogs. If one is working on being developed, will the ones for humans work? And then he writes, I don't own a dog, but I'm sure many dog owners will want to know this. I mean, we've all wondered about this. So do you have any knowledge about COVID vaccines for dogs or tests that have happened or
I know
studies?
very little about the veterinary world. What I do know, and certainly we'll defer to Dr. Richt,
Sure.
is, we know the zoos are giving vaccines to some of their animals, like the great apes and things like that. I'm not sure there's really any. I'm sure there are companies looking at vaccines for coronavirus for dogs and cats, but I would defer to Dr. Richt about that.
Dr. Richt, this is such a passionate topic for people love their dogs. We basically see them as humans in dog suits lots of times. So what is your knowledge on a vaccine for dogs?
Not only dogs, also cats and
Sure.
hamsters and hens and so on. So
We
have
love
a
our
lot
pets.
of pet animals, and we have to realize that they are very important for us and their family members. So anyhow, the question is, are there vaccines for animals? And the answer is yes. There are vaccines for mink. That's the only species right now in this country allowed to be vaccinated against COVID-19. And this is a vaccine by Zoetis, which is approved for vaccinating mink. And this vaccine was originally developed for cats and dogs. And we at Kansas State, in my shop, in my laboratory, we tested that vaccine for efficacy, and it was highly efficacious. And this is also the vaccine Dr. Hawkinson mentioned, which is given to zoos around the world to protect endangered animals, like primates, like various large cats, tigers, leopards, etc., and muscelids against COVID-19. But so far, USDA has not approved this vaccine to be used in pet animals, except for mink.
Such an interesting topic on all fronts this morning. I want to ask Dr. Richt to start when it comes to our final thoughts. What are you thinking this morning as we close out this discussion?
So one thing I want to mention, because we discussed this COVID in animals, and we already realized, and that we just published a paper when we discovered Omicron now in deer with our colleagues at Penn State. And so every virus which is circulating in humans is apparently easily transmitted into deer. And we also discussed that some of these viruses transmit from deer to deer and adapt and can become different, genetically different. So I want to encourage hunters to be very careful if they gut deer. Obviously, the hunting season is over, but for the next hunting season. And there is a method called gutless dressing, which you can do. You will not have the ribs, etc., but you don't open the cavities, and you can do a gutless dressing in order to protect yourself. But if you gut them traditionally, I encourage you to wear PPE, because a high percentage of deer, especially in suburban areas, seem to be infected with COVID-19. These are my thoughts to COVID-19.
Wow. That's really interesting.
Yeah.
Doctor, thank you so much, Dr. Richt. Dr. Hawkinson, what are your final thoughts?
I think there was just some good infection prevention points that were made here. Certainly continue frequent hand washing when cooking and using, uncooked dairy and meat. So we talked about that. Use frequent hand washing, and also, remember to fully cook those things as well, and that will help reduce the transmission, not only of viruses, obviously, but we heard other things like salmonella. So it is very important to be doing that when in the kitchen.
Thank you, Dr. Hawkinson. Dr. Richt, thank you so much. And finally this morning, if you needed a reason to take a nap or a good excuse, we have one for you today. It's National Napping Day. The unofficial sleeping holiday kicked off back in 1999. It's held the first Monday after we spring forward with our time change. The date was chosen because studies show people are already at their most tired and sleep deprived after daylight savings changes. Medical experts add that the change of the hour really makes a difference. However, taking a nap can make you feel like there was no change at all.
We typically say try to keep it shorter than at least an hour, because once again, if you are sleeping poorly at night and you start taking a 2-hour nap during the day, you're really going to throw your body off. Your body doesn't know if you're trying to just take a quick nap to catch up, or this is going to become your main sleep time.
Research has actually shown that napping is scientifically proven to be better for you than coffee or an energy drink. Napping tops everything. And if you're wondering, napping dates back to 700 BC with the ancient Greeks who would regularly, so they were the first ones to take naps. The ancient Greeks? All right, so they regularly took naps during the hottest part of the day. So we can thank the Greeks for that. I'm Greek, so I take pride that the napping came from us. March 30th is also National Doctors Day. That's coming up. And here's a way you can say thank you to all the healthcare providers. We know a lot of you in the community want to show your gratitude and your thanks. So on your screen right now is a QR code. You can do it by scanning the QR code. It takes you right to your email. The video cannot be any longer than 25 megabytes, about 30 seconds. So take a quick video thanking the doctors, send it back to us, and we would love to share it on air. Thank you so much for being with us today. And remember, you can watch our shows anytime by logging on to Facebook, YouTube, and now Twitter. Coming up tomorrow, the luck of the Irish is with many of us this week, but so still is COVID. And with the mask mandates easing, big question now, how do you celebrate with your family, whether it be at a party or a bar or eating at a restaurant, and still stay safe while watching the big parade? We're going to tell you what you can do to keep everyone you love safe tomorrow at 8 a.m. We will see you then.
Subscribe to our morning medical update and open mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.